All right, let's start this again. I apologize.
It's okay. I'm not sure if it was on our end or on your end, but everything froze. So we did have the Vax van going out in the community today, and certainly the van was at the Burning Thorpe Public Library. There's a lot of feedback. I'm hearing it. Anyways, I don't know if
Oh,
you
can you hear me
feedback.
okay? I don't hear any feedback, but
You don't hear feedback? Okay,
no.
that's me. Okay. Yeah, so there was obviously a lot of demand. We have over 1 million people who want to get their booster shots. So we are looking on how to build more capacity in the system. I know Dr. Lowe and his team at Public Health are trying very hard on, what next steps, how we build back capacity. It's not only resources that we need a commitment for, but also staffing. Because of course we had hired temporarily a lot of nurses and doctors and paramedics to administer the vaccine back when we ramped up in the springtime. The good news is that we are 88% double vaccinated 18 plus and 81% double vaccinated 5 plus. So there is a lot of good news there, but now there's still that 12% of people who still haven't had their first or second shot, and the people who want to have their boosters. So there is a lot of demand and capacity is limited, but the good news is they're constantly bringing on more appointments. So, book your appointment now if it's not till mid-February, because I know that there will be more appointments brought into the system, and you can check back in a few days or in a week, and perhaps there will be more appointments in the system.
Awesome. Will we see max vaccination centers back in Mississauga?
As a matter of fact, I have been speaking with Dr. Lowe about that, and they are looking at it, and that is probably a very likely probability that will happen. Probably not until mid-January. He's looking at it because, of course, it takes some time to ramp that back up again. Right, but we had the potential to vaccinate 20,000 people per day at a mass vaccination clinic, right? We're only doing just over 50,000 a week now between the primary care providers, the pharmacies that are open, and the couple of public clinics, Peel Public Health clinics that we do have, the one at Sheridan Mall and the one at, 7120 here, Ontario at Dairy Road.
Okay. Are there any spots to get rapid tests in Mississauga now, or are we just totally out?
So the province is out of them. They went at the LCBOs and the mall locations very quickly. I think within 3 hours at Square One Shopping Mall, and a very limited amount of time at the LCBOs as well. So I've written a letter to the Premier and to Minister Elliott asking for more rapid tests. I know the students were all sent home with 5 each, but clearly we need more. It's a good idea. I'm going to ask my kids, in fact, to take a rapid test before we sit down for Christmas dinner with my mom, because she's 85, of course, and I got her booster yesterday. Yay.
Nice.
So I'm very pleased about that. So we'll do a rapid test, but there are none available. So I know that the Premier is working very hard to secure more rapid tests, and I've asked that, number one, we retain more rapid tests, but we also expand the locations at which they're available. Let's be honest, not everyone's going to line up indoors at the mall, and that's probably not behavior we want to encourage, or go to the LCBO. We know we have many communities here in Mississauga that won't go to the LCBO to pick up a rapid test. So we need more locations, whether they're at libraries or transit hubs. We need more locations to distribute these test kits, rapid test kits, and we need access to more of them. And I think the province has pretty much gone through what they had for public distribution at this point.
Okay. And are bylaw officers back out in full force because of the new restrictions in regards to the 50% capacity at restaurants and, cinemas and stuff?
So this is very new. This change was made, last weekend. It is still only Tuesday. So they will be out, enforcing that. But, everyone's on their best behavior, and we're on the honor system right now. You know what the right thing to do is. We know that when we implement these measures and reduce capacity and ask people to stay home, transmission does decrease. And so we see that this variant, whether it's more severe or not, is 4 to 6 times more transmissible than the Delta variant. And we still have 12% of our population that hasn't been vaccinated, it will find them. And also there are people with who are immunocompromised. And those are the people that are vulnerable to this new variant, because we've been hearing anecdotally, and I know you've heard anecdotally as well, that it is less severe. And if you've been vaccinated, you could get COVID, but the symptoms will be less severe. But nonetheless, there are people who haven't been vaccinated and people who have underlying health conditions that could be affected.
True. How are the hospitalizations in Mississauga right now? Do you know?
Yeah, I do. We monitor that very closely. So there are not, they're very, let me call it very stable still. And I think the last time I checked, there wasn't anyone in ICU, but there were certainly people, yes, no ICU, but there were people hospitalized. Let's call it a dozen, 12 to 15 people. There are people hospitalized, but not in the ICU.
Okay. Let's do a quick year in review. I know you've been busy doing that today. What do you think the biggest Mississauga story of 2021 is?
The biggest Mississauga story for 2021 is, that's a good question. How about the announcement of the hospital bill? That's an enormous story for us. It'll be a multi-billion-dollar project over a period of years, and it's a very exciting news. It'll be a hospital network that will have over 1,000 beds. So that is very exciting. The progress that we've made on all our developments, Lakeview, where the power plant was, Brightwater, where the oil refinery was, the downtown core that is building, 9th Line. We had a new community center open, of course, in Churchill Meadows, so that was great news for us. I think we've really handled the pandemic well as a city. I see the spirit of our city has come through, the resilience of our residents. The food bank campaign was an enormous success, which just speaks to that spirit on how people are resilient and want to help those who are the most vulnerable. And, we had a goal to raise $400,000 and collect 200,000 pounds of food, and we collected $650,000 and almost 400,000 pounds of food. So since 2015, we have collected $2.1 million and almost 2 million pounds of food. So that's food for 7 million meals. So, very, very proud of that. So the food campaign, unfortunately, we have to have one, but it was very, very successful. So we have some, can't hear? Oh, and the other one I could mention, of course, is that Mississauga signed the urban diabetes strategy, so that we are cities changing diabetes, and we're the only active Canadian city involved with cities changing diabetes. So we have a strategy to combat type 2 diabetes, because that in Peel region, the rates are 40% higher than they are across the province of Ontario. So, when we saw that statistic, we knew we had to act and create a strategy that will help us work with the communities that are most impacted to reduce those numbers. And the communities that are heavily impacted are the South Asian community, the East Asian community, the Black community, the Hispanic community, and the Arabic community. So there are specific communities that we're working with to develop a strategy and and how to change lifestyle, really, because diabetes is prevalent among people who suffer from obesity or live a sedentary lifestyle or may perhaps an unhealthy eating habit. So these are the kinds of behaviors that can be changed, and we can help change. And as well, it also speaks to urban form. We've designed a city around a car. We need to have a more livable, walkable city, so people are encouraged to leave their car behind and walk to them. So live and walk in the same communities, build complete communities that are livable, walkable communities to encourage people to get outside and encourage active transportation. So whether it's cycling or or rollerblading, whatever it is, walking, to get outside and get some exercise. And this time of year, it's going to get much cooler than it is today, but there are really beautiful trails to enjoy. That the Column Trail and the Waterfront Trail are some of my favorites, and I go out as often as I can. So we just need to change behavior, but we need to come up with strategies with each of these communities to work with them to come up with these strategies. We've gone ahead and eliminated unhealthy choices here at City Hall, and I know that many of the school boards have done the same. So we don't offer carbonated drinks or prepackaged foods, and we need to work with communities to develop those kind of strategies as well.
Awesome. You still going at 45?
I am. Yes, I was there 2 days ago. I missed it this morning. I'll probably go tomorrow. But you know, we're concerned because we're at 50% capacity.
Yeah,
so it's very hard. It's very, very difficult to get your regular slot. We all want to go as often as we did. But we've put in place new measures now so that we're at our stations longer. We're working with greater isolation, so further apart from other people, and we're given more time to clean each station before we leave and move to the next one. So we put a lot of measures in place, and we carry our masks. So when we move from one station to another, we clean and then mask and then move. So we're trying to be as cautious as we can. Big shout out to Drew, Tyler, and Lish down in Port Credit, because they do everything they can to protect us and keep us safe.
Awesome. What is your proudest moment as a mayor in 21? What things?
My proudest moment. My proudest moment. Well, I think that I was elated when the Premier fulfilled our dreams and announced the building of the hospital. The food bank campaign, when we doubled our goal, just proved to me once again how Mississaugans are willing to step up and help their neighbors. I've got to think back to earlier in the year. Yes. So the announcement that the federal government has made, and I know that the provincial government wants to get on board, is the all-day two-way GO train service on the Milton line. So Minister Alghabra, who is our local guy, we're very proud of him and so delighted to have the Minister of Transportation right here in Mississauga. He has made it a personal commitment to get the Milton line open for all-day two-way service. So that's a huge win for us as well. So we've had some big wins. You know that the LRT is proceeding and should open by the fall of 2024. And if you don't believe me, travel on here, Ontario. Lots of traffic, lots of construction happening. Something else?
Yeah.
And then finally, and I would say finally, the fact that we suffered some of the highest COVID rates in the first, second, and third wave. And now we're high adopters of the vaccine because we want to prevent a future wave occurring here in Mississauga, here in Peel region, because we know the nature of our community. The people live and work in the community. We are home to some of the largest employers, and whether it's workplace spread or community spread or household spread, we don't want that. We don't want people to point at us as having high rates of infection here. So people have gone out to get vaccinated. We are 88% double vaccinated. That makes me very proud. 81% of people 5+, 88% 12+, 18+. And the people who are lined up to get their booster. So, when we have the rate across Ontario is 74%, and we're so much higher, that makes me very, very proud.
Nice. Is there anything you regret, Mayor Crombie, in 21?
The regret. We regret that the restrictive measures we've had to take and impact the businesses as we've done. There are many people, many businesses that have suffered, many have shuttered, and there are things that keep me up at night, and that's one of them. The fact that the businesses have been so severely impacted. These are our small businesses, people who are our friends and neighbors in our community who take the risk and make the investment. These are entrepreneurs, and many of them have been forced to shutter. So some of the measures have had a severe impact on local business. But yet, on the other hand, there are certain large businesses that have thrived, and we've still continued with, there have been large investments made into Mississauga, into our business community, 200 million into the resilience plant, right? Bora Bora opened, a large pharmaceutical company. What else can I highlight? Cognizant, HCL Technologies, the there are a number of other investments that have been made which proves that Mississauga continues to be the place where business choose to invest. So notwithstanding COVID, businesses were expanding, like Roche Pharmaceutical invested $500 million and created, I think, 500 new jobs. So businesses were thriving, but it was that the cost of the smaller businesses, because of the measures taken to shutter them during the periods of lockdown. So if we could have done things differently and avoid lockdowns, it would have been my preference.
And the biggest issue going into 2022 for you, Mayor Crombie?
The biggest issue for me going into 2022, well, you know, continue to build a thriving city, you know, a livable, walkable city, as I said, build complete communities. We're still faced with our operational deficits, given the state of our infrastructure. There are always capital deficits in our capital plan. Transit still continues to face operational deficits as well, because we're not up to 100% capacity. We're still about, you know, 50 to 60% capacity. And then I will say housing. The climate change is an issue is always in the forefront of our minds, but also providing choice and providing housing affordability so that people can stay in Mississauga, can choose Mississauga as a place to raise their children, as a community in which to retire to, so they can downsize from their home to something smaller and more manageable, and to make it affordable for middle-class, middle-income earners. So these are huge challenges, and we need to work with other levels of government, provincial government, federal government, to incentivize the sale of surplus land at prices that we can build affordable housing, that we can work with the development community to deliver a product that's affordable. This is very important to me and to all the mayors, the Ontario big city mayors. We've had a number of conversations about this. We were all looking forward to a summit that the Ontario government called, the Premier had called. It had to be postponed because of the rise in the Omicron variant, but we hope to meet with the Premier early in the new year and work on these issues together. This can't be solved by the municipalities alone. This has to be a cooperation between the development community, the provincial government, possibly even the federal government, to incentivize the building of more, you know, subsidized housing, and the provincial government to work with us to deliver affordable housing for the middle classes, you know. And could we do things better? We could do things better to get product out to market, but we have 20,000 permits that we've approved that the developers haven't actualized. They haven't pulled those permits and begun to build. So this is an issue. The supply of affordable housing is a very big issue. We know that the average cost of a home, single detached home in Mississauga, is well over $1 million. In fact, the average cost of housing is $800,000. So this is a significant issue, preventing families from choosing Mississauga in which to locate and raise their families and stay and, you know, invest here. And this is an issue facing all the mayors across Ontario, and we're working together, and I hope with the province, to find solutions for these issues so more product can be brought to market in a form that's affordable for middle-class families and appropriate for middle-class families. It's one thing to build small units that are cheaper, but they can't house large, you know, families.
True.
So this is a very, very important issue that we'll continue to work on going forward.
Well, Mayor Crombie, thank you so much for being with me for the last 2 years. We've gotten over 5 million views, 8 million overall with the other mayors of the great cities. So I'd just like to thank you. And you know what I love about talking to you? Your family always watches and sends me questions directly. So here's one for you, okay? What are you getting your favorite granddaughter for Christmas? There was a name involved, so I won't say the name, but...
Well, I only have one granddaughter, and her name is Athena.
Okay. She wants to know what you're getting for her.
And she's a shepherd husky blend, and she's beautiful. And Athena has a cupboard in my home that's just all treats for her, and she knows where it is, and she goes in there and smells all the treats, and, you know, sits at the door patiently while we deliver treats. So we got her a number of chewy toys and squeaky toys that she will have to play with when she comes to my home. And Bone.
Wait, so Athena's a dog? Athena's a dog?
He's a dog. dog. This is my grandchild.
Sorry.
She's my grandpuppy.
Okay, all right. That's why I didn't say her name. It's Athena.
My children are all very well placed. They have they have partners, and they're very happy. But nobody's at that stage where they're having children yet.
I didn't know it was a dog. Sorry. So awesome. All right.
My son Alex clearly posted that question.
Merry Christmas to you and your family.
Thank you. Merry Christmas. Thanks for having me.
Okay. Take care.
Happy holidays, Kara. Bye-bye.